Hello and welcome to my channel. Has anyone you know or you yourself has been diagnosed with prediabetes, or you know someone who has been diagnosed by the primary physician that has prediabetes? Come here and let's share knowledge about what prediabetes is, the struggles and frustrations that comes with it. The stage before an individual is diagnosed with diabetes or type 2 diabetes is called prediabetes. And I must confess, it comes with a struggle and frustration. Prediabetes means that you have a higher than the normal blood sugar level. It is not high enough to be considered as type 2 diabetes, but then it's far away from being normal. That's from the 70 to the 90 for the fasting in the morning. But the good news is that with prediabetes, you can actually make changes with lifestyle changes and with your diet. And then even if you're at risk as developing type 2 diabetes, you will be able to halt the progression of you being type 2 diabetes. So that's the good news about when a doctor tells you you are pre-diabetes, you still have the chance to make some changes to be able to stop yourself from being diagnosed with type 2 diabetes. If you're pre-diabetics, the long-term damage of diabetes itself, which is your heart could be affected, your blood vessels could be affected, your kidneys could be affected, though these damages are not so prominent yet, but they are starting. So if you're being told that you're pre-diabetes, there is every tendency that the damages that are done to these major organs like your heart, your kidney, your blood vessels are already started. It might not come with any symptoms yet, but then this damages is already being done even if you don't know it. So that is why it is so important that when you're told you're pre-diabetes, you should do all you can and be disciplined enough to be able to make the lifestyle changes, to be able to make the diet changes, and majorly to exercise. So the same lifestyle changes can help to prevent you from having type 2 diabetes, both in an adult or both adult and in children. This could help to bring the blood sugar level back to normal if you keep with the lifestyle changes and then you getting some exercise in. So for the symptoms of prediabetes, really there are no symptoms that are seen. I've read in some places and I've been told by some people that the possible signs of prediabetes is that you might find your skin being darker in some part of your body. Like this could include your hand, your armpits, your groins. You can just be noticing some subtle darkening of your skin. If you're light skin, well, if you're from Africa, if you're dark skin, I guess that's difficult to see. But then since there is no major signs and symptoms because it's not full-blown type 2 diabetes yet, but if you're someone that goes to your doctor and they do the annual checkup that you can do, you might be able to know that your blood sugar is a little bit elevated. If you're going for your annuals with your physician, they might be able to monitor this and let you know if your blood sugar is getting out of range. And this is done majorly by monitoring your HbA1c, and this helps you to monitor your blood sugar and see what it looks like. The HbA1c is a blood test that is done to monitor what your blood sugar level is for the past 3 months, and this will give you an average range. So if they keep monitoring this and it's out of the normal range, you might be told that you're pre-diabetes. That might be a step for you to know that you're pre-diabetes and you have to work on it. Another important thing is that if you have a family history of diabetes, if you have a strong family history, I guess it's a thing that you have to keep monitoring your blood sugar just to be able to know that you are not, because you're susceptible to having type 2 diabetes. So you will be able to know that, okay, this is what I have to look out for. So yes, though the signs and symptoms are not so prominent, but these are ways that which you can find out that you have that you might be prone to have a pre-diabetes. The classical signs of diabetes, however, especially type 2 diabetes, is increased thirst, frequent urination, you are very hungry, you have increased hunger, you're fatigued, you're having blurry vision. Sometimes you have tingling and numbness of your feet and hand. There's frequent infection, especially for females and women. You tend to have recurrent, probably UTI, vaginal candidiasis. There's so slow healing sores. Like if you have a sore on your body, it takes a longer time to heal. And then you have an unintended weight loss. This is so important, because when you notice that you're losing weight and it's not like you're fasting or you're trying to eat a little bit healthier, it's something you have to go to your doctor and check and see what is happening. It might be a classical sign of diabetes. So if you have all the signs or some of the signs, like you're urinating a lot than normal when the weather is not so hot, or you're having increased hunger, you're easily fatigued, you're losing weight, you're having recurrent infections, it's better to go see your doctor by that time to check out to screen you for type 2 diabetes, and ask your doctors what you can do. Let's talk about the causes. The causes of pre-diabetes really is not known, but like I said earlier, a strong family history or genetics actually appears to be a major role in it. So if you have a family member, your siblings, or one of your parents that has diabetes, there's every chance that you might be susceptible to having it. What is clear is that people with pre-diabetes, however, may not proceed to having diabetes if they have a major style change. Most of the glucose in the body comes from what we eat. So when the food is digested, the sugar enters into the bloodstream. There's something in the body that's an hormone, which is an insulin, which allows the sugar to enter into the cell and lowers the amount of sugar in the blood. Insulin is produced by a gland behind the stomach, which is called the pancreas. The pancreas sends insulin to the blood when you eat. When the blood sugar level starts to drop, the pancreas slows down the secretion of the insulin into the blood. So insulin actually helps to regulate how much sugar it's in your bloodstream or enters your bloodstream when you eat a heavy meal. When you're pre-diabetic, this process doesn't work as well. Instead of fueling your cell, sugar is built up in the bloodstream. And this can happen because your pancreas is not making enough insulin, or your cells become so resistant to the insulin and don't allow as much sugar in. So either the body is so resistant, or your blood cells is so resistant to the insulin that is being produced, or the insulin that is produced by the pancreas is not enough to help to help to work on your blood sugar. So these are the causes really of pre-diabetes. As for me, I have a strong family history, and this has been a struggle for me for 2-3 years now. I've been trying to modify my lifestyle, eat healthy, and then do some exercise. Some factors that might include the odds of you getting type 2 diabetes and increases actually the risk of pre-diabetes is just if you're heavy weighted, you have heavy weight. If you're overweight or you're obese, there is every tendency, this is a predisposing factor to diabetes. Your diet, if you're taking lots of red meat, if you're taking lots of processed sugar, sweetening beverages, this might predispose you to pre-diabetes. If you're someone who doesn't exercise a lot and it's just taking it easy, this might be a greater risk for pre-diabetes. Age, however, some people do say that at the age of 35 and above, your predisposed to the pre-diabetes. I really think this is attached to you being active and not being active as you are when you're younger, going to college, reading and stuff. By the age of 35, you're trying to like settle down in life, just go to work, come back home. You don't take so much pleasure in going out. This is tied to inactivities. For me, that's what I think. So yes, they said age predisposes you to pre-diabetes. Yes, like I mentioned, if you have a strong family history, it might be a predisposing factor for pre-diabetes. If you're a woman who has gestational diabetes, I really think this could predispose you to pre-diabetes also. Gestational diabetes is when someone is pregnant and then you have elevated blood sugar during pregnancy. Sleep, tobacco smoking. Tobacco is tied out to so many things, really heart conditions, lung conditions. So, well, there has been some researches that actually tied tobacco smoking to pre-diabetes also. Other conditions might be high blood pressure, high cholesterol levels. All these are tied down to being pre-diabetes also. Prediabetes has been linked with a long-term damage. Like I said, it's linked to a long-term damage of your heart, the blood vessels, the kidney, which is very, very important to me because if it progresses to diabetes, to type 2 diabetes, you might eventually be end up having renal problems, which is a silent killer. Most of the important thing also is that prediabetes is a long-term damage to the heart that might cause silent heart attack for people who has it. Prediabetes, however, can actually progress to type 2 diabetes, and this could lead to heart problems, stroke, kidney disease, nerve damage, eye damage, amputations in the long run. So all these complications I've talked about, let's talk about the prevention. Okay, that's where the frustrations and the struggle comes in for me. The prevention of you being diabetes is actually a healthy lifestyle choices can prevent pre-diabetes and the progression to type 2 diabetes, even if it runs on the family, even if you have a strong family background, history of diabetes. A healthy lifestyle change will actually help a lot, and this includes eating healthy, getting active, losing excess weight, controlling your blood pressure and cholesterol, and most importantly, not smoking. But for me, the most important thing is eating healthy, because this has been a great thing for me. I don't know how I'm going to get over it, but I'm trying my best. Keeping to eating healthy is a very important thing, and then the exercise. Walk sometimes will not make you have the chance to exercise, but I guess with discipline, you might be able to put in 30 minutes of walk every day or exercise every day religiously. Actually goes a long way, keeping your heart healthy and making sure that the blood sugar is regulated, and then you're keeping away from type 2 diabetes. Another important thing is to make conscious effort to eat healthy, and then control your cholesterol. That's what I want to say. Your cholesterol. Controlling your cholesterol means you have to cut off all the fats that you eat, stop eating red meat, eating the lean meats, and this helps to actually reduce the cholesterol that we have. That you might end up at the bad cholesterol that you might have. Pardon me on that. So eating healthy is something that for me has been a struggle, because I really think that right now I should be enjoying myself. And then while I was younger, I actually have my fall from soda, especially Coca-Cola, and it got to a point that I thought I am actually addicted to it. But I've been trying as much as possible to cut down on that, get some water in. Water is very important in trying to keep away pre-diabetes. So for me, the struggle is on, and I'm trying as much as possible to keep at it, and hopefully God help me. What I have in mind and the goal I have in mind is to stay healthy and alive for as long as God wills, not to be in any ill health from pre-diabetes. I'm progressing to type 2 diabetes. So yes, that's my frustration. I just want to enlighten every one of us. I hope this actually helps someone though. If it does, please subscribe to my channel, like my videos, and then I'll talk to you more about health. And you can look at me, I do a lot of recipes too, like crocheting. So if it's something you like, please subscribe to my channel. Thank you very much. Bye.